very amazing speakers today that will be sharing their experience. And so I would like to start it off now. So first of all, I would like to call Dr. Kunji and Dr. Sushiji. So we would first like to light up the candles, and then if you would like to say a few words, you're more than welcome.
First of all, thank you very much for coming to celebrate the Hahnemann's birthday in this. This is for the first time we have taken the initiation. Because if you read in the WhatsApp, in the news, on the website, India celebrated Hahnemann's birthday like anything. 6,500 people gathered at Yashobhumi. And in compared to that, what we are doing? So that's why we took a initiation to integrate all the homeopaths, to give support to all the homeopaths, to unite, and as it has been said that united we stand, divided we fall. If somebody having a sound problem, all the homeopaths can unite and we can solve that problem. So that's the basic intention, that is the basic aim to organize this small celebration. This is a non-political thing. There is nothing like senior, junior. We all are equal. We all are colleagues. We all are followers of the homeopathy, and we all are following Dr. Hahnemann's principle of similia similibus curantia. And this is why we are here. Really, I am highly thankful to all of you that you remain present on this small occasion. We want to take it to a massive scale. We want to share our homeopathy to every home. That's why I give one slogan: homeopathy at every home and homeopathy for everyone. So thank you very much for coming to our this homeopathic celebration day. Thank you.
Good morning again. Thanks for coming and sharing your time with us. I know we are all here for the celebration of the Master's birthday, 269th birthday. It doesn't matter how many we are, but we should know how sincere we are. Even small gathering with a full confidence and love and care, we all will celebrate Hahnemann's birthday, the birthday of our Master, who is one of the guiding source for health in the world. Even the biggest homeopathic doctor and allopathy doctor, they respect him and love him for this reason, because the science he gave is a direct indication for treating the disease. There is no science in the world which can confirm and guarantee that what we can do, what we can't do. Here patients are coming to us, I will tell you later on, but briefly I am telling you. We are not worried about what we are going to treat. We can treat anything from A to Z. Even one symptom can lead us for the next symptom, subroutine, ultimately reaching the goal of selecting a remedy that is called similum. The basic law of Hahnemann, they gave similia similibus curantia. Jahar ko jahar katta hai. Visha visham uttam in Ayurveda. So without going too much, because it will be later on when my dear brother will give you some information, I will share with you the detail. So thanks for coming, and I'm very happy to see my brother and all of you here. Thank you very much.
Now we are inviting Dr. Vinodkumar ji over here to share some views about homeopathy.
Thank you, Dr. Nikunj, especially Dr. Sushiji. I think it's I'm a youngest one and learning about science, and with all senior people around me has guided me very well. Being in a homeopath in a family, I born and brought up in a homeopathic family. My father is a renowned homeopath and groomed me in such a way that I always say homeopathy founder Hahnemann is the daring personality ever got into the making inorganic to organic laboratory. No human laboratory can do. He tested and given the wonderful science to the world by testing himself on his tongue. And that's why he called daring soul. And being in a specialist myself, my guru or my founder of the specialty also learned many things from the homeopathy founder Hahnemann, and he is the one who actually made a system based on the law of principle, as Dr. Shashi told that this was the ancient principle, or we can say first medical system on the earth, who given the medical system all over the world, always says love similar. And I must say here, being a specialist, being a practitioner, I learned one thing from the Hahnemann, and that is he is the first man who actually brought a medical text from the spiritual science. He is the first medical doctor who actually given allopathy name to the science, which is called mainstream. He is the first doctor who has actually today's modern chemistry or modern pharmacology actually doing too many research on the pharmacology, as well as he is the first person who made science, spiritual and science together. So that's why I respect Hahnemann. Today's birthday, 10th April, and he is even reinvented the law of similar into the medical system. And being a specialist myself, I pay tribute to this great personality among them, my senior homeopathy. Thank you very much.
So now we will start the writing tables.
Yes.
So we can give tribute to Dr. Hahnemann.
To the fruits.
Happy birthday to Hahnemann.
Happy birthday.
Because of we became the follower of homeopathy, and because of his blessing, what we are today, we are.
Yes.
And we must celebrate Hahnemann's birthday, and this time it's a 269th birthday.
Yeah.
So it's a great day for we all homeopaths.
Thank you.
And respect in the society.
Yes.
We are respected. That's the best thing, yeah. Because
That's why second largest system on the earth
Yes.
become today's.
I would like to call Pradeep Gorji to share her experience as well. Thank you. Samuel Hahnemann, a great inspiration, a great practitioner. From the 17th century, homeopathic has been obviously progressing, and it's progressed worldwide. And I, Hardik Kaur, thank you Sabita for calling me on. I'm basically a specialist EH practitioner. We've been working for over 25 years, and our founder, Seema Tai, had a great inspiration from Samuel Hahnemann on the way he went on to the dilutions and using plant-based medicines, because as mentioned before, allopathic medicines, they're very good for emergency parts, but obviously they have their side effects. And working in a natural field, helping to naturally save and heal people, treat people, We obviously deal with all kinds of diseases, over 700 diseases basically, many cases, different cases we have been treating. So I would like to again thank you Dr. Nukunji for inviting us here today, and on this very special occasion of the 10th of April, the birth anniversary of Samuel Hahnemann. So it's just a little bit of experience from my side. So thank you very much.
Thank you so much, Pradeepji, and I would like to now call on his experience, please.
Thank you.
1994 में होम्योपैथी में कोर्स किया था, तो since 1994 we never used allopathy at all. Okay, the whole family हमारी जो है ना वो सभी यही होम्योपैथी यूज़ कर रही है. तो इट्स ब्रिलियंट थेरेपी जिसने हमारे घर में सीरियस प्रॉब्लम भी सॉल्व कर दी. तो फिर स्लोली मैंने ना, मुझे डॉक्टर विनोद जी मिले, तो पहले भी मैं स्पाजिरिक में इंटरेस्टेड था, और इन्होंने आके मुझे इंट्रोड्यूस किया. मैं दोनों ही यूज़ करता हूँ, होम्योपैथी एंड स्पाजिरिक मेडिसिन. दे आर बोथ ब्रिलियंट थेरेपी.
Very accurate, different remedy. Stupid, no related answer, different remedy. So homeopathy is a science of wonder, and I think no one has done better than him. He is my hero. I don't care any hero, the top hero. I like 3 people in my life. Swami Vivekananda for the spiritual for knowledge, Mr. Hahnemann for medicine, and third hero Netaji Subhash Chandra Bose. Top hero.
Thank you so much. Thank you very much, Dr. Shashi ji.
मुझे लगता है कि आज डॉक्टर शशि जी ने हमारे अंदर वो जोश दे दिया है.
बिल्कुल.
So he given a wonderful, और मैं I am a disciple of Dr. Satyapal.
Very good.
Who written from the Calcutta, who written 12 books on homeopathy, 44 remedies is the best one, Kent one, and William he translated, and Jan publisher book. He reminded me one thing, Dr. Shashi ने आज मुझे वो याद दिलाया कि he asked me first question when he came to my, he was 83-year-old, I was 20-year-old that time. And Dr. Satyapal motivated me in that way. He said, आपने होली बुक पढ़ा है? मैंने बोला कौन सा, किस धर्म का? बोलता होम्योपैथ का. ऑर्गेनल. मैंने बोला नहीं. कहते वो पढ़ो आपको पता लगे आप क्या बनना चाहते हो. मैंने बोला आई वांट टू बिकम एमबीबीएस डॉक्टर इन इंडिया. Being my father as a homeopath doing miracle in the community, I don't give a respect. I said no, I want to become an MBBS doctor. He said, Dr. Satyapal, straightforward, come forward and said, the science of homeopathy, the science of Hahnemann is 25 years ahead from the
100 years ahead.
that time. And now is probably 200 years ahead. So he given me that motivation that I can't forget that how become homeopathy. You know, he said, आपने कभी energy level पे quantum physics पढ़ा है? No. पढ़ो आप. Just go and see the power of energy. And today, everything is energy. And probably one thing, last thing I want to say, it was the Hahnemann who actually given the root to the modern medicines in 200 years ago.
Amazing. We'll move on now. Thanks so much.
Thank you. But we have to be passionate, we have to be honest.
One interesting. That is why I'm here.
पर education में बहुत ज़्यादा है.
मैं कहूँगी कि अगर अपनी फ्यूचर मिस इंग्लैंड ने ना बुलाया होता मेरे को, तो मैं आता नहीं यार.
Miss England.
That is your winner.
She's Miss England. Wow.
And I wish her all the best.
Miss England. She's
Selected for
Miss England.
going to
Academic in terms of what I do. I teach, I lecture, I manage department. I'm retired now. But Dr. Vinod के साथ और फैमिली के साथ थोड़ा ताल्लुकात भी रखता हूँ because मेरा भी इंटरेस्ट है. दवाई के हिसाब से नहीं. Let's be absolutely clear. It's nothing to do with medication. It's just the fact that I was brought up in India. So Ayurvedic medicine हमेशा दिमाग में रहती है. So I connected the two. It may be wrong, and I'm sure they will tell me after lunch.
बाल आप हनीमैन की तरह रखते हैं बॉडी
ये तो आपकी निगाह में है।
कुछ अलग बात है, वहाँ मत जाओ, वहाँ मत जाओ. No, my point on the issue is that when you're learning something like this, what you need to be clear now. I'm sitting there observing, learning, and what I'm trying to understand. Two things comes out very clearly. You're doing wonderful job. A lot of you are putting a lot of effort and energy into what you do. Academically, also with people practicing locally, Birmingham, Leicester, Slough, jahan bhi. One thing I find lacking is your coordination. हमारे में बोलते हैं ना, खुद का अगर झंडा ना लेके खड़े रहो ना तो कोई निशान नहीं देगा आपको. You need to blow your own trumpet, जैसे हम इंग्लिश में बोलते हैं, because you're not doing that as far as I'm concerned. You have fantastic examples. डॉक्टर साहब ने अभी 3-4 बड़े खूबसूरत एग्जाम्पल्स दिए कि किसकी बीमारी किस तरह उसने ना दवाएं देके एक झटके में बंद कर दिया. एलोपैथी होती तो 6 महीने तो पहले आप मरते रहो और फिर पेट में कुछ और दवा होगी. So you need to get together on a basis of ensuring that you show case studies, validated case studies. अपनी बनी हुई नहीं. I'm a great believer. My background is sciences. I was a research chemist at Cadbury's for 9 years, and then I went into education. We don't believe in anything that is hypothetical. It needs to be absolutely validated.
Yes.
It also needs to be revalidated by somebody else. मैं खुद का झंडा लगा के पहनूं तो I'm obviously being very good. I don't think that is what is necessary. What the practitioner, the young lady with the skin issues, asthmatic issues, जो बोली डॉक्टर साहब ने, get the public to know, because I don't think many people actually know. Unless you come from India, Pakistan, parts of Africa maybe, or other people from the eastern sides of country, you would not know much about homeopathy. सिर्फ जर्मनी में शायद ना. ये मेरा तजुर्बा मैं कह रहा हूँ आपको कि at the end of the day you need to make it a global concept, because the damage is done by allopathy is perhaps far greater. My son is a pharmacist, by the way, so if he hears me say this, he will not be happy.
That's why Hariji, we are giving respect to the Dr. Nikunj who
Who's arranged
this
this?
issue. Yeah.
Absolutely, and Dr. Trivedi has done a fantastic job.
Really, we appreciate that what you suggested. And one thing I would like to draw the attention of all the homeopaths. Dr. Sharma told about how he practiced, right? But nowadays the thing has been changed. People are asking for the evidence. And without you give evidence, people will not believe. How far you intelligent? That's irrespective of your intelligence, but people need evidence. So now I'm encouraging the young homeopaths to practice clinical homeopathy. Whatever you have seen in the blood results, give homeopathic treatment, and then what changes has been happening to the blood results in the X-ray, in the MRI, then all the allopathic doctors will start doing.
Great advice. Yes.
And this is a shot of a future homeopathy.
Yes.
That days has gone that when we repertorize, even I'm one of the collaborator of the repertory. I have written a repertory on infertility, and my repertory is being used in 87 countries. Recently, I have treated one patient, and I have shown that patient to Savita as well.
Yes.
Savita is a witness,
Yes.
right? That patient was being treated by the NHS for the asthma. It was not asthma. Just like Amitabh Bachchan, there are hundreds of Amitabh Bachchan are mimicking. Same way, the disease pattern is also mimicking like asthma. It was a eosinophilia. Eosinophilia is also mimicking like asthma, but while looking to the nails. So Hahnemann has told that be a good observant. Physician should be a good observer. Looking to the nails when there was no clubbing, patient does not have any asthma. I can challenge that. And here 90% of the patient, those who have been labeled for the asthma, they don't have real asthma.
Yes. Yes.
Nebulizer given.
They are taking bronchodilators, they are taking nebulizer, they are taking inhalers, everything. but it's all waste of money. That all money goes into the drain by the NHS. If they have been diagnosed correctly, then we can save the money to the NHS and we can save the health of the patients for developing a side effect. And this case has been repertorized by me. And the medicine was coming to the carcinosine. And I challenged that no, this patient does not have a picture of carcinosine. I treated that patient with the natrum salt and patient is 100% better. Blood result shows the eosinophil was very high. 20 in a cubic millimeter of blood. That came down to the 4 cells per cubic millimeter of the blood with the help of natrum salt.
Very good.
So this is how we should develop our clinical skill, our clinical knowledge, so we can challenge any other pre-diagnostic conditions. Like, okay, patient with asthma, okay. Observe the nails, read the blood results, and if it is not matching, if you are not getting convinced with your clinical skill, treat as per your heart says. And that's why I always say that listen to the whisper of your heart. Always listen to the whisper of your heart, and that will completely change the diagnosis and the quality of the life of the patient. So clinical homeopathy is a new era in a homeopathic treatment. Even COVID, after COVID, there was no any symptoms like COVID in our repertoire. But nowadays they have added new symptoms. Yes, they are including the COVID side effect and post-COVID complications as well. So always look at the constitution, diathesis, miasm, but on top of that clinical condition as well. And before treatment and after treatment, once you show the results to the society, to the patients, to your colleagues, allopathic doctor, then they will start believing homeopathy. And this is the future of homeopathy.
Great advice, Dr. Nikunj. Thank you very much.
And that's why we are getting patients every day with a challenging conditions. Parkinson. There is no cure for the Parkinson. We are treating Parkinson. Patients, one patient from Sutton Cold. When I was treating that patient was getting better, and he was shaking, confused, had a history of head injury, history of stroke, was not able to walk clearly, and after 2 months, 3 months, the patient's deity came with the patients again, that you know what happened. Then I said, something went wrong. Oh my God, don't ask me. That patient took the car, he went to the barber shop. And that patient has been scolded by the family members. So again he started adopting it. So mental shock is very, very important.
डॉक्टर साहब यही हमारी क्लिनिकल स्टडी में स्ट्रगल होता है.
Clinical skill is very important. And here, those who are studying homeopathy with few hours, evening classes, evening courses, that homeopathy is not real homeopathy. They need a complete clinical exposure. I work in gynec department for 3 years. I work in surgery. I assisted Verdheims. Cancer surgery, I assisted Verdheims. I work in all the department, in medicine, in gynec, in ophthalmology, except dentistry. Sorry, Dr. Atul.
Believe it for you.
I have not worked in dentistry.
It's a bit of practical thing.
Yeah. But I work in all the departments and I came across all sorts of chronic conditions. So when patient comes to you, at that time you have some clinical background, that what are the abnormal pathology and what is your duty to bring that abnormal pathology to the normal physiology. And that's how you will get the success in your clinical practice. This is my tip, advice, request to all the homeopaths.
That's why I want to thank you, Dr. Nikunj, कि हम लोग जो यंग प्रैक्टिस करते हैं ना, उनको क्लिनिकल एविडेंस की बहुत जरूरत है और वो स्ट्रगल करते हैं होम्योपैथी में. और आज जब मैं पहली बार निकुंज जी से मिला तो उन्होंने वो नर्व्स पे हाथ रखा जो कि होम्योपैथी प्रैक्टिस में स्ट्रगल करता है, और वो है प्रैक्टिस में क्लिनिकल एविडेंस बेस्ड. और जब उन्होंने मुझे बताया कि मेंटल केसेस विस्कम एल्बम से कैसे चेंज आ सकता है.
I used his medicine I was not initially convinced with the surgery, but when I used Viscom album with the autistic patient, oh my God, it has made a havoc.
Great result.
Very good result. I never believed that autistic patient can be treated with the Viscom album in such a nice way. So there are some miracles, there are some hidden miracles in the medicine, but the application is very, very important. You must be knowing one joke. कि किसी की कार खराब हो गई, somebody has some problem with the car, he brought that car to the mechanic and mechanic saw and mechanic thought that 100 pounds and he just banged one hammer on that and he asked that, oh, you have done nothing and you are charging 100 pounds. He said that no, for banging the hammer on the nut is only 1 pound, 99 pound I am charging for my skill. So this should be the thing.
That's
If we are clinically skilled,
yes.
then no one can challenge us. And we can prove homeopathy in a best way, in a best route, and in a best way of application on the patient's clinical condition. And this is what my advice to every homeopath. And that's why I'm always telling that I'm a medically qualified clinical homeopath. I'm not a simple homeopath. Because if you bring any cases, I got that reason. If I'm able to treat, I can say yes, I will do. If I'm not able to do, I'll say sorry. And homeopathy has shown very good results on genetic condition, and that has been documented in Switzerland. They are doing very good research, and that's why I always advise that go on clinical side, learn clinical aspect, and then treat. Thank you.
I want to say something very special. You will be very surprised. I know about 300 to 400 homeopaths in the United Kingdom. More than that, maybe 500 or whatever. But I love talking to him, and I love listening to him. Sometimes we are going for 30 minutes, 40 minutes, or 1 hour. My wife never stopped me. Otherwise, she don't like noise in the house. But Dr. Vinodkumar is on the phone, for the free hand. I respect him for his honesty and his knowledge for clinical medicine.
Because he is genuine, honest, practical person.
And one more thing, Dr. Sumita, Mrs. of the Nikunj, has the energy, invisible energy.
Yeah.
And Dr.
Without her, I can't function.
I learned.
Without her, I can't function.
No, all good doctors have got a good wife.
Pradeep and Savita was impressed when we know about the doctor, Mrs. Nikunj. She's a great personality. I think you should few words for a young guy. Few words, please. Please.
2 words.
Come on, madam.
Yeah.
You can come here. Please, come here. Let's see the secret of the life.
Vital force we have to be seen.
I would say one thing, you should be sound in your knowledge and you should be confident enough what you are doing. Thank you.
That's great.
My friends is Singalore.
To thank everyone for sharing their amazing experiences, and we would like to move on to the cake cutting. So I would like to welcome Dr. Nikunj and to cut the cake, please.
Big one?
Yeah.
Yes. उनके हाथ को
सब यहाँ हाथ रख दीजिए।
that's right.
All yes.
Round of applause, everyone.
Happy birthday to Hahnemann.
Great scientist.
Okay, now
Excellent.
we can, means you will have to.
Yeah, distribute. No worries. That's fine. Thank you so much.
This is right.
Where to put some lunch?
Ready for the cake, please.